Thank you, Representative Clyde, Representative Carney. Thank you all for inviting me to chat a little bit about the incredibly important subject of women's health care. I'm here today because there are concerted, well-funded efforts to put women's health care in jeopardy. This is a critically important time for women's health care. We are in the midst of implementing the health care reform that gives women new access to essential health care services. At the same time, we are facing unprecedented and regressive state-level restrictions on the very same access. These opposing forces are creating enormous turbulence for women who simply want to get healthy and stay healthy. You know, I'd rather not talk about politics, but mostly because my focus is really on providing health care to young people, like all the young people back here. But we have to talk about politics, because politics today are eroding the health care options available to women of our communities, and it's these women who are suffering the consequences. In the past 3 years in state houses across the United States, there have been hundreds, thousands of bills introduced, of which 211 were enacted regarding women's health care, about what I can and can't do with a pregnancy, about whether I can or cannot make decisions about my own health or my own body. In Ohio, a small, vocal group of opponents and their state house allies have politicized women's health care. And for the past 3 years, the General Assembly has been pursuing a relentless agenda of restrictive laws that have no medical purpose. The Ohio legislature undemocratically added many of the abortion-related provisions with little public consideration to the biennial budget. These included the gag rule for rape crisis centers and their counselors, a reprioritization of family planning funds away from family planning providers like Planned Parenthood, a ban on transfer agreements between public hospitals and licensed surgical centers that provide abortions, and compelled speech of our physicians. Physicians now must conduct an exam to detect a fetal heartbeat, notify the woman of the presence of that heartbeat, and read a script telling the patient the statistical likelihood of that fetus being carried to term. And failure to do this would result in criminal charges for the physician. Not one of these laws reduces the need for abortion. They simply are designed to reduce access. Representative Ross McGregor, a Republican from Springfield, was one of the politicians who voted against the budget. When asked about the stand he took, he replied, and I quote, "These budget bills have become the repository for policy decisions. It's a lot more convenient to add these into the budget because then you don't have to be bothered with people expressing their opinions." He further stated, "The process has been twisted so egregiously that it put me over the edge." We know how he feels. I think Planned Parenthood lives over the edge sometimes. The attacks on women's health care keep coming, including the new HB 248, the so-called heartbeat bill. Now, it's clear that many Ohio legislators don't put the health care of Ohioans before politics, but Planned Parenthood does. And we are grateful for legislators like Representative Kathleen Clyde, Representative John Carney, and others who stand with Ohio women against harmful legislation. We need more Ohio legislators to stand with them. And we need every woman and her family in Ohio who opposes these restrictions to call their elected officials and demand that these laws be repealed. Thank you. I'd like to take a